specialist immigration firm. Well, let's get a perspective on how this will impact on the NHS. Danny Mortimer is Chief Executive of NHS Employers. Good evening to you.
Good evening, Andrew.
How critical is this shortage?
I guess the first thing to say is that actually what we've experienced is what your previous contributors just described. We actually have been recruiting the same number of doctors from outside the EU for a number of years, but what we found was that as we recruited more nurses from outside the EU, because fewer were coming from within Europe in this last year or so, we had fewer work permits available for doctors and also for other professionals. We do have a shortage. That's clearly why we're recruiting outside, and that's why the government announced 2 years ago that it was going to expand the number of medical school places by 1,500 over the next few years, and that's started to take effect. There'll be extra doctors entering medical school this year, and there are extra medical schools that were announced by the government a little bit earlier this year as well. And that is explicitly intended by Jeremy Hunt and his colleagues to ensure that the UK has less and less reliance on doctors from outside the UK.
All well and good, so we create these extra spaces in medical schools, but how long does it take to train a doctor, Danny?
No, it's a very, very fair point that you make. It's 5 years at medical school and then probably another 8 or 10 years until the doctor is proficient as a specialist or as a GP. So there's a significant lead-in time there, Andrew, and in that lead-in time we are reliant to a very large extent on colleagues from outside the UK to fill posts within our hospitals and other services. And that's why this change that the government announced yesterday is so welcome. It helps us in the NHS, but it also releases permits for other sectors as well. We know that about 60% of the permits that were being rejected were for other employers who are trying to bring in scientists and engineers and other vital professionals as well. So we hope this step helps them too.
It means, doesn't it, that the cap that's being lifted is going to be lifted indefinitely, or certainly for another 5, 6, 7 years, until this new wave of people joining medical school are trained, qualified doctors.
I mean, the government has said they're going to review this position again in the spring next year, and they're commissioning a review to conclude by then to see what needs to happen to the system. Clearly, as a country, we need a new migration system when we leave the European Union, the Prime Minister, I think, is fairly clear that she believes that the decision to leave the European Union is one that's intended to make sure that we have greater control over our own migration system. I think what we and other employers would argue is that we do need to have a migration system that brings in talent from elsewhere in the world, as well as obviously allowing our people to go and work elsewhere in the world too. But we need something that is perhaps a little bit more flexible, a little bit more considerate, particularly in our case, of the contribution to public services. Again, as was previously described, the immigration system we have at the moment allocates work permits for people from outside the EU based on salary, which is why doctors, up until 6 months ago, found it relatively easy to get work permits, and why nurses, who are in profound shortage, had to be placed on the shortage occupation list 2 years ago by the government because they weren't meeting the salary thresholds that the system requires. So we do believe, we do believe within the timescale that you've described, there will be a new migration system for this country, and obviously we want the government to introduce something that takes better account of the services we provide to the public. 35,000
nurses, unfilled vacancies. Is that a record?
I think it's hard to say, Andrew. The workforce that we have it expands constantly as we need care for our patients. We employ about 260,000 nurses in the NHS, but you're right, we should be employing much closer to 300,000. Again, nurse places are being expanded, but we in recent years have seen really important sources of recruitment within the European Union, but also elsewhere in the world, particularly the Philippines. And these colleagues are vital members of our team, and we're going to rely on them for a very long period indeed.
Front page of the Daily Mail, I'm sure you've seen it. 4 in 10 GPs quit the NHS within 5 years of finishing their training. Many switch to short-term locum work on higher pay and better hours. Others practice abroad or leave the profession entirely. Each doctor will have cost the taxpayer $500,000 to train over 10 years. Why are so many GPs abandoning the NHS, Danny? And should there not be some handcuffs